First of all, thank you everyone for participating to the workshop. It's a real pleasure having you as part of our participants and experts. The workshop is, I'm Serena Bianchi, project manager of the iProcureSecurity PCP project. The project is funded by the European Commission, and the workshop today, the sharing innovative approaches to strengthen resilience through preparedness during health emergencies, wants to give a general overview on the project itself, and also to gather, which is, let's say, the main scope of this session, to gather feedbacks and inputs from the experts, meaning from all the participants who are taking part into the workshop itself. So just a couple of general rules, let's say. The first one is that the session will be recorded and then published on our ProcureSecurity PCP YouTube channel. So if you prefer not to show off, you can switch off your camera. The participants are, except of course the speakers and the moderators, will be muted by default. If you want to ask questions, please just raise your hand and we will unmute you and you can ask any question and I will answer you. Otherwise, there is also the chat session in which you can post questions. So we can, I think we can start already. I will give the floor to my colleague, Bernard Jäger, who will introduce you the project itself, as I was mentioning, and then we will go a little bit more in deep with our speakers in some hands-on experience on mass casualty incidents and how they have been dealt. And then we will start with the interactive sessions, including your feedbacks and your insights. So I leave the floor to Bernard.
All right. Good morning, everybody. I hope you can hear me okay. My name is Bernhard Jäger. I'm research manager and department lead of Synio. We are a highly dynamic company focusing on research, innovation, and technology located in Vienna, Austria. And we are coordinating the iProcureSecurity PCP project. And just trying to move on. Today, I'd like to give you a short introduction about the project itself. We are our team of 8 procurers and a lead procurer from 5 different countries, mainly EMS-related organizations that are responsible for pre-hospital care of over 40 million people. All in all, in the project, we are 12 partners. So besides the procurer partners, there are also 3 supporting partners, including Empirica, AHD, and Synio, that support the procurers in all activities throughout the project. Beyond that, we have additional 10 external advisors that support the project, and we have a large EMS network board, which also supports us, which is included in discussions, and this is a virtual area, so everyone who is interested in the topic, feel free to join us. We will tell you at the end a little bit more about the contact information and how to participate in further activities that the project is doing. The vision, the main goal of iProcureSecurity PCP is to improve triage scenarios in mass casualty incidents through a flexible triage management system. The project focuses and fosters the R&D services in order to build an innovative solution in this domain. The importance of triage management, it's quite obvious, but to highlight it here again, it's in mass casualty incidents, so in situations like earthquakes or large natural or man-made disasters, you have to deal with a lot of casualties at the same time, and it means you have to sort casualties into priority groups according to particular needs and available resources, and ensure that you use the scarce resources in the most useful way based on personal supplies, equipment, transportation, and medical facilities. We chose this topic, so IPS PCP is actually based on a previous project, which was a coordination and support action where we screened the whole EMS ecosystem, and we finally found that especially the triage management is an area which perfectly fits for a pre-commercial procurement project, because the problem is it's a MCI is a low probability but high impact events, which means it affects the access and the quality of care and delivered by the EMS systems. And the problem is that as you don't have these situations regularly, also to have enough funds to kind of improve the situation and the service in this domain. And of course, the goal is also to reduce mortality and increase the overall quality of life of the casualties. So it has a really high impact. And also trend-wise, we also see in many studies that are coming up, then the number of natural and man-made disasters is increasing. We have more and more risk drivers like climate change, urbanization, changing security landscape, and technological developments, which also influence these mass casualty incidents, and which have to be considered. Why is triage management important, and what are the current issues? Why did we choose this particular topic? We talked with a lot of EMS staff members in different areas and in different domains, so from people working in the field to people at the kind of highest decision-making levels, and we found that there are several areas which where triage management having severe issues. So one part is the planning and decision making. Often it gets complicated for the head of operations to keep an overview on a very chaotic situation while staying in touch with different other stakeholders in the area, with the dispatch center, with other first responder organization. Often there is also missing information on environmental conditions, scarce data for decision making. We also found out that resource allocation sometimes doesn't work as efficiently as it could be. That also afterwards analysis of data is very complicated, because during the events, of course, it's hard to constantly document what is happening, and also that there is no fully automatic monitoring of assessed casualties. Also regarding triage practice, we were told that in many cases the practice is not very flexible, so it's very hard to adapt to very specific cases, or especially rare cases that come up, and also that retriage can be improved. Further on, also data transmission can be improved. A lot of communication is running via radio, and also here often it takes time to transport information, and especially in loud and chaotic situations, it also can be hard to understand other stakeholders while talking on the radio. And a very big topic for us is interoperability, which means that we have a lot of fully isolated solutions in the domain, and also often even within particular countries, systems are not very well connected. And in many cases, there are electronic health records which exist, but which actually cannot be used because these kind of connections and interoperability is missing. So thereby, this is also a very important topic for us. Always like to show this one because it gives a very good impression what we're focusing on. Actually, we're mainly looking at the on-site domain, so the triage management on-site, which means we have, besides the victims and the paramedics, we have several other important players which are performing the tasks on site, and we have a lot of connections to additional stakeholders like the dispatch center, the ambulances, the hospitals, other first responders, which are important. So the main idea is also to finally move from today in many cases from a fully paper-based system to a new digital version which allows to share information more quickly and more accurately, and also is able to support the decision making. So we have several challenges that we want to tackle. So first of all, the quick and accurate overview of casualties is important. So a system that distinguishes different roles, displays all the casualties at a glance, allows also to identify the casualties. So it's very important that you have a unique ID, and ideally also can recognize them later on which casualties are or were on the scene. And we also want to have a solution where one device is directly attached to the patient, which provides all of the important information such as status ID, and further also collecting information about the casualty like vital signs, and which also allows you to, of course, include further information and adapt further information on this particular tag for the casualty. Another important point is the decision making, so decision support for better allocation of the available resources and quicker support for casualties, where the system should allow, of course, to assign new roles and users, displaying pictures and images of the area, allowing also to adapt these images to connect them also with other first responder organizations. Get complementary information about the environment, about weather and traffic conditions, get further decision support on, for instance, which hospitals are around and how many free ICU beds are available, and also a system that supports the staff management, so also that you can see which staff is currently available on site, and where also the communication between the staff is improved. Further on, we're also looking for a better communication and coordination of the EMS actors. So quickly sharing live information, storing and exchanging images, and also ensure that the system is also working when there is no public network connection. Further on, also the reduced handover times are important for us, which means it's important that the stakeholders can more quickly also hand over important information from instance, from the area of the event to the ambulance, and from the ambulance to the hospitals. Insights for quality assurance and training measures are important. So also to ensure that also after an event, the event can be analyzed and evaluated in a useful way. This is often very complicated at the moment because, as I said before, documenting and collecting data during these chaotic situations is not very easy, and then a fully digital system also should help with that, also to offer better and real data also for improved simulation purposes later on. And as mentioned, interoperability. So also here it's important to have a harmonized terminology, to have and make use of existing APIs, and also sharing the data with other first responders in the most useful way, as well as also sharing of clinical data, especially on-site and then also with the ambulances and the hospital. So much quickly about the topic, how we are doing that. So as said, the iProcureSecurity PCP is not a typical research project, but a pre-commercial procurement project. And for those of you who are not familiar with PCPs, PCP has the idea on in the first month to collect main requirements, identify use cases, understand the whole situation and the area for the particular procurers, identify the market, understand the market out there, find interested suppliers in this domain, and then based on this initial information, create call for tender documents, and finally start a call for tender, which is open to suppliers who can respond to this call, can come up or should come up with the most innovative ideas in answering the particular challenges. And based on the phased approach, there will be selected up to 6 suppliers in the beginning. And during the phases, the consortium will decide which are the most interesting and innovative solutions that fit best with the actual needs. And the goal is to finally end with 2 suppliers and 2 solutions, which will be then also fully tested. So in the first phase, it's more concept and design and solution architecture, which we're looking for. In the second phase, there will be already initial prototypes that are developed. And finally, really in the last phase, we will do a full testing with pilots also at our procurer sites to ensure that these 2 solutions can be really tested in a realistic environment. Why are we doing it this way? It's really a win-win for everyone involved. It's a benefit for taxpayers because actually it provides better access to public services. The idea is also to foster innovation through a competitive approach. It's also is attractive for foreign investment and should also increase employment demand. For the procurers, they actually ideally get a solution which is perfectly fitting to their actual needs. They can further steer also the process during the development. There will be a very strong connection between the suppliers and the procurers during the process. Of course, it also should increase the quality of service, and it should also allow them finally also to select the best option for the individual procurers. And for the suppliers, of course, it's also a great opportunity to enter new markets, a retention of IPR ownership, having the opportunity to testing it under real-world conditions, and also shortening time to market activities. Good. The overall roadmap, we already have completed by the end of last month our open market consultations. So as I can see, several participants in here joined us already, which is great. Now we're looking for someone in May to start the call for tender. So we'll now consult with the European Commission and provide the current status, and afterwards, I said most likely to around the end of May, we will be able to initiate the call for tenders, and then afterwards we'll go around September into phase 1 and then phase 2 and phase 3. Good. So much about the overall activities of the iProcureSecurity PCP project. And as we have then also more in-depth discussion about certain points which the project is interested in, we first actually wanted to have a few also external voices from other areas and other regions, which providing an intro on mass casualty incidents and how they're dealing with. And Serena, I think we then can move on to the first slides of the partners, right?
Yes, so thank you very much for this introduction. Yes, now we can dive into the challenges in faces mass casualty incidents, and we have three speakers, which we deeply thank to be part of this workshop. Mr. Gianmatteo Apuzzo, who is Senior Project Manager at the Central European Initiative, Mr. Manfredi Rizzo, who is member of Research and Internationalization Unit at the University of Palermo, as well as part of the hospital Paolo Giaccone. And the third speaker, Lucia Di Furia, who is the Director of Marche Region. So we will leave the floor first to the first speaker, and we will again try to understand now a little bit more from a empirical perspectives, what are the challenges when facing mass casualty incidents. And based on the inputs, we will then continue on the interactive session. So I would leave the floor to Mr. Gianmatteo Apuzzo.
Hello, good morning. Can you hear me?
Perfectly.
Yeah, thank you. Okay, good morning, everybody. Thank you for inviting me to this workshop that is really interesting, also considering what is happening in the last years. So it is really important to share experience and ideas how to deal with the mass casualties and emergency. I represented the Central European Initiative, and I will take the topic not from a local perspective to a transnational, but on the opposite side. So speaking about the transnational cooperation, regional cooperation to strengthen the response to emergency. Next slide, please. Also considering that I'm not a medical professional, I'm a project manager. I have experience in emergency, also in the Balkans and the Middle East in the past, and most recently, just a few words about the Central European Initiative, that is an intergovernmental organization founded in 1989, and it includes 17 countries. As you can see, these 17 countries, nine are EU members, and we are speaking about Central, Eastern, and Southeastern Europe. 5 are not EU members, but enlargement policy, so pre-accession, and this is Western Balkans. And what is most important, maybe in this period, is that 3 member countries have the neighborhood policy, and it is Belarus, Moldova, and Ukraine. And you can understand now how is very important for us the situation of Ukraine. Please, next slide. How we work? We work on multi-diplomacy, multilateral diplomacy, regional cooperation, but also on project management. So a project-based approach on the topics and priorities of organization. You can go on, please, because this is a slide with the 3. Yeah. And health sector is included as a priority in the plan of action of Central European Initiative. As you can see in this slide, is rightly focused on the readiness in addressing different and persistent emergency and strengthening the capacity and preparedness of health system. Next slide, please. In the emergencies and mass casualties in the CEI area in the recent years are mainly 3. Maybe someone in this moment is not remembering that we have faced a mass migration through the Balkan route that is not ended. But of course, there were a couple of years where this is a high priority also for the EU policies and programs. Of course, we had the COVID-19 outbreak, and this year we are facing the Ukraine war with internal displaced persons and refugees in the bordering countries. Just to summarize from the beginning, what are the common challenges in all these mass casualties, incidents, and emergency? The first one is how to implement emergency services, an emergency response, and a long-term response. As we have seen in most casualties, mass casualties in the world, the prolongation of the displacement of refugee condition need to be addressed also with long-term response, and sometimes this is lacking. The second point is how to maintain essential healthcare services while activating emergencies, and this is what is called dual track. This is one of the main issues during COVID-19 pandemic. Of course, when you have this mass casualty, one of the issues and the challenges is the access to healthcare services, not just emergencies, but in general healthcare services. The continuity of care is a big issue, considering both what can be continuity of care for people migrating, so also changing place where they are based during the months or years, but also continuity of care between different health facilities, for example, for during COVID-19. Integrated care is very important because there are many stakeholders, many organizations providing healthcare in different healthcare facilities and settings. One of the issues and common challenges in the different profile of mass casualties is the exchange of data. And in the exchange of data, of course, monitoring the citizens, monitoring people, monitoring conditions, and tracing people is an evidence that is an issue. And we face a lot of problems with tracing the COVID-19 outbreak. And of course, the governance model, leadership, the different roles in the mass casualties, and the coordination between local and central level has been a common challenge and issues in these emergencies. Next slide, please. As I said, I'm trying to give you a transnational vision of how to deal with the emergencies. During the COVID-19 pandemic, the Central European Initiative, jointly with WHO Office for Europe, established a task force that included health officials and health experts from the 17 CI member states. This is a task force that I've been coordinating that was based on the management of the Central European Initiative and technical advice from WHO. And it was a platform to exchange experience and ideas and service in how to deal with the pandemic in two ways. One, health services and measures for response to the emergency, and the other one, how to address the economic and social impact for recovery. So there are two main directions of work, investigation, but also work. One was to highlight the weaknesses of health system, and the other one was how to strengthen the capacity of response and resilience. Next slide, please. So just to summarize some lessons learned during this 2 years of work of the task force, just to clarify, we had for the first period bi-weekly meetings, so really hard work. And then we had monthly or bi-monthly meeting in the following phase of the pandemic. The following key factors were considering the key element to deal with the pandemic: a robust governance mechanism, as I said, governance model, relations, rules, and coordination between different organizational at different territorial level, strong data analytics and sharing. So the one of the issue at the beginning of the pandemic between the states and the countries was also how to measure, how to trace, how to test, and also how to share, the possibility to share the data collected. Of course, as we know, digital solution was one of the main aspects to respond to the emergency for monitoring and for caring people, and effective communication, also considering what is trust, what is collaboration, but also what is the issue of fake news. The following are considered the modalities how to ensure resilience and response to the pandemic. First of all, of course, a strong emergency management system. Of course, we can speak about emergency services, long-term services, but this is not possible without an emergency management system in each organization, and of course, as a general social and national and regional system. There is the need, and it is crucial, of course, to respond to immediate short-term needs, because at the beginning you have this mass casualty that require immediate response to the needs. To implement continuity of care, as I said, integrated care models. I don't want to repeat, but what was clear to the participants of this task force is their need to strengthen primary care services. So not just hospital, but hospital care, but community care, home care, and digital health services. One of the lessons learned is that, I think that for professionals this is completely clear, is that no solution may be considered permanent. So you need to be flexible to change as you have new developments of the pandemic and or new advancement in the scientific knowledge. Next slide, please. Two are lessons learned from the ground, and this is specific, for example, for Italy and for Friuli Venezia Giulia. In this case, I'm based in Trieste, and one was the management vulnerable people, but mostly the need for a comprehensive response to the older person risk, because we experienced the issue that older persons were at significantly higher risk of mortality, but they suffered additional different vulnerabilities, and also some of them based on subject to discrimination, so discrimination in medical care, but also in triage, life-saving therapies, but also some impact on mental health and social relation because of the prolonged isolation, and in some cases also violence and abuse. The second issue that is very, very important, as I said, in my region, but also in other Italian region, was the underestimation on infection control in long-term care facilities in nursing home that suffered a delay in receiving a recommendation, in receiving support, in receiving training, and in receiving also protection materials. So the main focus when you have an emergency is clear that is on hospitals, but it was clear also during the COVID-19 that long-term care facilities needs the same attention. Next slide, please. And these are open issues that we discussed in the transnational and regional cooperation model, but this was shared as unsolved and an open issue. One is that when you have a deployment of a solution that is made with unprecedented speed, you have to consider that you have maybe standard deployment, standard protocols, and standard deployment of this solution, but you have to keep in mind health literacy levels and digital skills on the ground. So be aware on account of different levels of digital skills and digital resources, but also basic health literacy. As I said, data sharing, I don't want to stress again this point. We experience weaknesses in comparable testing, but mostly tracing system and tools. And what was clear from starting from a couple of months more from the beginning of the pandemic is the pandemic fatigue. So you have to deal also with, due to the prolongation of the pandemic, with the motivation, decrease of interest, hopelessness, and alienation. Next slide, please. And this is some principle that we share. I don't want to read all these principles, but this is a principle that we share among countries in a transnational cooperation modalities. That is, for dealing with the pandemic and mass casualty, you need people-centered approach. As I said, it is quite natural to have a standard deployment of services in emergencies, but without a people-centered approach, you can have a lot of also unexpected casualties, also while providing emergency services. Solidarity and trust was one of the main issues. This is related to communication. This is related to the prejudice, but it's also because of the prolongation of the pandemic. Health governance, again, and maybe science-based information is the most important point. The link between decision maker and science-based information is a crucial point to deal with the pandemic. Next slide, please. And this is just an example of a project that, because there was this general transnational cooperation, but we activated, promoted, and funded directly some small project at local level. This is one project between Friuli-Venezia Giulia region, Albania, and Montenegro. And the objective was to provide evidence and support expansion of ICT solution to increase preparedness to public health emergency. Because the common issue that was clarified at the needs assessment phase was that despite the arrangement that the health system in different countries made, several essential health services were either discontinued or provided at a diminished scale. So there was a strong collaboration between the three countries on ICT solution to deal with the pandemic. And this is just an example of what was activated in Montenegro, that the primary healthcare center in Podgorica that served 1/3 of the overall population in Montenegro. And there, as you can understand, there was a congestion at the primary healthcare center in responding to all the needs related to the pandemic. So the objective of this project, of this small pilot, we can say, was to unblock the bottleneck in the provision of COVID-19 services. And it was activating a digital call center that was adopted as a digital solution for providing response, advice, made by digital consultation by nurses and physicians to improve the risk perception. So, of course, it was also based on providing information, but while facilitating triage, testing, and clinical care for COVID-19 pandemic. Next slide, please. And let me conclude with, again, going back to mass migration, but due to forced migration. And this is related to the ongoing Ukraine crisis due to the war. That is a really hot topic and sensible topic for us. And just to clarify, the Central European Initiative is supporting with also funding instrument, is supporting Ukraine and Ukrainian people. We are directly supporting the International Red Cross operating in Ukraine, but we are also supporting some camp hospital in Ukrainian beyond the support that we can give at local level for the response to the mass migration of refugees. crisis. So considering this conflict situation, you have maybe we can speak about three levels of issues. One is internal level of issues, that is the vulnerability of healthcare in conflict. So of course there is a lot of issues in this case: capacity of emergency services in the country, healthcare services for internal displaced persons, medical facilities that are most targeted by bombing and destroyed. Of course, you have shortage of workforce, medical supplies, and so on. As external issues, so the bordering countries that are receiving refugees, the preparedness response are based on mostly quick response measures, that is monitoring people in need, access to healthcare. And in this case, you maybe know that the European level took a decision for giving the Ukrainian citizen all the like fast track recognition, their conditions, so they can receive directly healthcare services. And in Italy, in our region, for example, they can have immediately a fiscal code to receive the health card to access the healthcare services.
Sorry to interrupt. We need to close up
because
we are a little bit late with the schedule.
Yeah, this is the end. But just to say that, of course, you have also other simple solutions like translation of guidelines of information of healthcare services. There are epidemiological issues related to some condition like tuberculosis for Ukrainian crisis, but also vaccination and other conditions like the huge incident of HIV on Ukrainian population. One of the common issues in all these casualties is the lack of mental health services and post-traumatic stress disorder prevention and early intervention. I think this is the last slide. So we can conclude. Yes, thank you very much, and sorry for being a bit late.
Thank you very much. It was a pleasure. Now we will just leave the floor to our next speaker, Professor Manfredi Rizzo, who is Associate Professor of Internal Medicine at the University of Palermo. Just the time to share the screens. Okay, so Professor Manfredi Rizzo.
Thank you. So good morning, everybody. I hope you can hear me clearly. So I'm truly delighted to be part of this meeting. Thanks again for the very kind invitation. And I wish to share with you our innovative approach, that is the syndemic approach, with the ultimate goal to improve the quality of life of our patients and to reduce their mortality. Next slide, please. So let's become a little bit more familiar with this word, syndemic. And as you can see from this cartoon, there is a lot involved with this term. The next slide, please. I will try to be on time with the 10 minutes assigned to me. So what about syndemic? So basically, it's a conceptual framework for understanding diseases or health conditions that arise in populations. And a very critical point is that such situations are exacerbated by social, economic, environmental, and even political factors. So here is the case where healthcare professionals like myself need to go beyond pure health in order to make a better management of patients. Next slide, please. So during this long COVID-19 era, the question is, do we need a syndemic approach for the diseases management rather than the traditional pandemic approach? Next slide, please. I will try to answer to this question. First, recalling that Dr. Singer in 1996 introduced this terminology of syndemic that comes out from sociology, so something quite distant from medicine. And demos is from Greek, people, and syn is again from Greek, means working together. So the main difference from pandemic means all people, is that this is affecting for sure all people, but all people wish to work together with a multidisciplinary approach and considering the social context, including migration, poverty, racism, or marginalization. Next slide, please. Something that we experienced in Italy was about the indirect impact of COVID on mortality. As you perfectly remember, our country, Italy, was the first European country seriously affected by COVID. It was basically exactly 2 years ago. And we immediately saw in Italy that many people unfortunately died at that time for direct reasons of COVID because of the virus. But in parallel to that, other people were dying every day for the so-called indirect impact of COVID, which led to a large excess mortality. Basically, any subject with pre-existing medical conditions, particularly those subjects with chronic diseases like diabetes, obesity, cardiovascular diseases, they were exposed to a significant higher risk of complications. And this is something that unfortunately led to such excess mortality. Next slide, please. This is something that we reported quite soon for Italy. This is a study we published in JAMA Internal Medicine. No, the next slide is fine, thank you. And then this was confirmed at European level. So there was an excess rate of mortality among Europe in 2020 for both the direct and the indirect impact of COVID. This is dramatic data, and of course, this inspired us to do something innovative. Next slide, please. Another critical point is that during the current pandemic, inequalities, disparities have been exacerbated. And indeed, increasing socio-economic disparities have been reported in so many different populations worldwide, not only in Europe. And indeed, the spread of the virus is for sure facilitated within subjects with the poorest social conditions. And now, during the current vaccination campaign, we need to prevent more inequalities. So we need to be sure that all the different populations can receive proper vaccination. Next slide. Thanks. And again, this was quite soon perceived and reported. This is an elegant study from Harvard University in the United States, and they clearly showed that inequalities in the United States were significantly associated with COVID-19 mortality. You can see here that people living in the most disadvantaged conditions with increased poverty, crowding, or even racism was associated with the highest COVID-19 death rates. Next slide, please. Therefore, why a syndemic approach is so important? For sure, this is more appropriate for this type of pandemic, because there is a strong interplay between the virus and the disease, COVID-19, related complications, and the overall social structural environment. And the term syndemic therefore emphasizes the importance of biological or biomedical, social, economic, and environmental factors for the health of individuals and populations. And as physicians, we have for sure the responsibility to take into account all these factors together. Next slide, please. Yes, this cartoon is again emphasizing the importance of multidisciplinary approach. You can see in this slide so much that is needed in order to properly manage our patients. Of course, there are aspects that can be done by healthcare professionals, and there are other aspects that must be taken into account by health authorities and organizations. Next slide, please. Yes, I'm going through my conclusion. This is basically the last slide of my brief talk. Last year, we created an international panel of experts in order to promote the syndemic approach for chronic diseases, particularly focused on cardiometabolic diseases, since these type of alterations are strictly linked with COVID-19 mortality. I'm talking about diabetes, obesity, and cardiovascular diseases. And in this international expert panel, we are quite proud to have a consistent presence of European experts. The next slide, please. I just wish to thank all of you very much for your attention.
Thank you very much for the presentation, extremely interesting. I would leave the floor to the last speaker, who will talk about Lucia Di Furia, who is PhD and Director of Marche Region, who will dive into the challenges faced by earthquake. So giving very straightforward empirical approaches when dealing with mass casualty incidents. And please, Lucia Di Furia, the floor is yours.
Good morning to all of you. Thank you for inviting me to this interesting meeting. We try to know how to respond to all the type of emergency. So the next, please, next slide. My presentation is on the following themes: earthquake experience, but also lessons learned from this experience, and preparedness of Marche region to new, similar, or different events. Next, please. My region, as you can see, is a small region in the middle. It's different from the reality. This is the place of my region, Marche region. And the earthquake was in 216, and it started at 3.36 am in the 24th of August. It was 6 megawatt, very growth, and followed by growing event of magnitude of 6.5. We have 299 victims during the first event. Unfortunately, during the second, most even people had already abandoned their homes. We have 238 citizens extracted from the debris and 388 injured citizens brought to hospital. Next, please. 87 municipalities were involved in an area of about 4,000 kilometers square, and over 31,000 citizens have been displaced in hotels on the coastline. Many over 65 years old citizens and a considerable number were great senior, more than 18 years. Next, please. In the Marche region, a coordination group has been set up for many years, more than 10 years, bringing together civil protection activities with voluntary work. The group is called GORES, Regional Operational Group for Health Emergencies. This group is active in emergencies and organizes and conducts the necessary activities to meet the health and social health needs of citizens affected by the emergency event. In addition to the regional civil protection, the GORES includes regional health experts who normally deal with planning of hospital care, emergency, territory, prevention, veterinary, and food, etc. But also regional representative dealing with social issues, representative of individual companies in the territory, the emergency number 118, representatives in the territory, and voluntary association. But other specific professionals are invited to respond to specific types of emergencies when they arise. Next. The GORES activation time is fast. We participate in the national initiative coordinated by the province of Trento of alert exercise, which allows a rapid activation. It meets in the operational center of Ancona. The earthquake was in the 4 in August, about half hour the majority of the group was present in the CO to put in place the necessary response action in liaison with the National Civil Protection and other stakeholders involved. That is the fire brigades, the prefecture, the majors, etc. Next, please. The first thing that struck me was that about 10 minutes after we meet in the CO, we received a phone call from a major. A small mountain hospital had collapsed. The patients were fortunately all alive and had been brought out, but their ambulances had been crushed by the perimeter walls of the hospital. We organized spaces to receive the inpatients, while the internal emergency plan for a massive influx of injured people, PAMAF, were activated in all the hospitals of the region, and we managed to get a few ambulances shuttling from the destroyed hospital to the saved hospital. And also many residential homes, many facilities for older people were attacked by earthquake, and within a few hours they were accommodated in tents and safe spaces or in other residential facilities. In the following days, we organized a proper structure with beds to accommodate those patients to take them out of the tents. Next, please. Public health and civil protection provided, and now we move in lesson learned. Public health and civil protection provide a concrete and valid response to citizen needs thanks to the courage, inventiveness, and generosity of operators and institutions, but also thanks to the organized systems between civil protection and health system goals. However, we have learned that during an emergency, new care needs arise. Caring for a high number of patients who had suffered serious injuries, new emergency health needs. We have older people to be hospitalized, sick people to be moved, older people who were previously cared for at home were now left alone as their former carers left. Care needs after the earthquake, including the need for psychological assistance and psychical rehabilitation. Next, please. And So we learned that the reorganization, we need the reorganization of care models, ensuring care in the places affected by the earthquake, for example, and increasing care in the locations where people were moved. Addressing mental health and rehabilitation needs the medium and the long term. There have been psychiatric consequences such as post-traumatic stress disorders, depressive disorders, and other mental health symptoms. Inequalities in the way the earthquake impacted on health were found particularly in women, children, older people, people living with a disability, and rural communities. Next, please. The response to the damage and health risks caused by such disasters must be planned and organized well in advance of the emergency and with greater adequacy. So, the next. We talk about preparedness, the state of being prepared for a particular situation, and we think that preparedness is possible and necessary at community, organizational, and system level. And it's necessary to mitigate the negative health impacts of natural disasters, not only earthquake, but we know something, we understand a lesson from earthquake. Next, please. So we have a new regional health and social plan 2020-2022, citizen integration, accessibility and sustainability. Next. This plan talk about the reflection, and we reflected in the action needed to deal with emergencies. So we identified the appropriate leaders, the necessity to identification of appropriate leaders, the overall planning, the step training, the intervention plans to be made operational in the emergency and the post-emergency period, and systems for monitoring all aspects of health, education and training, increasing awareness and risk communication. The next. And in addition, citizen participation to ensure an integrated approach is needed to health monitoring at all stages, from planning to interpreting results and defining the necessary intervention. Systematize the knowledge accumulated by institutions, politicians, research, and the population affected, which resulted in developing concrete experience, concrete actions. Training operators so that they are able to develop the managed protocols for data collection and analysis, also through a multidisciplinary approach to health surveillance, identifying priority indicators for health, access and provision of services, data measurement and analysis. The next, please. Again, develop the surveillance of the population affected by disaster, with particular attention to vulnerable population groups, involving professionals and researchers to develop knowledge for community resilience, ensuring efficient information system capable of withstanding crises, such as the development of a new dedicated emergency number, NUE 112, now is allocated in my region, and this consent to have the disaster recovery system that guarantee continuity of assistance even in case of serious damage to local telecommunication systems. But also developing telemedicine systems that can be easily reconfigured when healthcare facilities run into difficulties. Next. Defining a communication plan able to reduce the damage caused by fear, stress, and uncertainty, and to control anxiety and stress and increase the resilience of the population. Guarantee efficient services in the veterinary and food safety area for an adequate health response in order to achieve the common objective of public health protection. The next, please. Therefore, we included in the plan a pathway to be implemented for the effective management of health intervention in major emergencies. The objective is to develop the quality and the appropriateness of services and treatments, accessibility and proximity. The action envisaged are to co-create procedure shared by all the regional subjects belonging to the regional health system, to disseminate the procedures also through training and exercise activities also involving citizens among all the regional health system services involved in the management of emergency situations, to provide organizational, technical, and logistic adaptation of the single hospital ward to cope with emergency situation. The next, please. Action to increase the health response capacity to the emergency event, rescue capacity in the territory, health transport capacity, intra and extra hospital treatment capacity, to design a unique web-based platform at the regional level from which to obtain real-time information on the operational availability. For example, patients' accommodation capacity of hospital and social medical structures connected to the management system of territorial emergency networks for responding to major emergencies. Next, please. But the plan to put in place, we had not even the time to put it in place, the emergency provisions of the new regional social and health plan approved at the beginning of February 2020, and the COVID pandemic started. But the previous experience and the thinking were of great help to approach with the COVID pandemic or syndemic experience that we all have. Thank you to all of you.
Thank you very much. It was extremely interesting to have these hands-on experience on how regions face mass casualty incidents in this specific case, earthquake. And I think it was also a very good introduction also to the system, which is now under, which wants to be developed by the project iProcureSecurity PCP. So now we enter into the interactive session, also considering all the inputs which have been given by the speakers in the previous session and taking them into account. Now what we would like to do is to better understand which other inputs we can gather from external stakeholders, such as you are, the experts in this workshop, and to see what can be helpful in order to develop a system within the project of iProcureSecurity PC project, which can be helpful for the operators on the field. So as my colleague Bernard mentioned before, the iProcureSecurity PCP project wants to create a system, a solution, which supports the emergency medical services on the field in specific actions, such as decision-making process, such as reduce the handover time for the transportation, and so on and so on. So we have actually identified within the project 5 major challenges, which are the one you see in the slides as well, meaning the solution wants to support for a quick and to have a quick and accurate overview on the casualties and their status. The second challenge is to support, as I was mentioning before, the operators on the field in the decision support, in the decision making process for better allocation of resources, and therefore also, of course, a quicker support to the casualties themselves. The third challenge is to improve interoperability, as mentioned also in the previous presentation, and has highlighted also by the speakers as well, the importance of interoperability. The fourth challenge is to reduce the solution wants to reduce the handover times between ambulance and transport and hospitals, so supporting in the operational needs as well. And last, addressing the challenge of insights for quality assurance and training measure. So all those challenges will be addressed by the iProcureSecurity PCP solution, while building the technical solution. So we can go to the next slide. Again, we are now in the phase of creating the requirements, highlighting the requirements, and drafting the call for tender so that suppliers will be able to build and develop a solution which meets all the challenges we have identified. What we would like to do in this session is to, again, as I was saying before, gather some inputs from the experts, as we consider you expert in this field. And for doing so, we have some questions. We would like to open as well the discussion with you. We will launch some question using WebEx. So you will see now on the Slido on the right part of the screen, some question will pop up. The first session will be dedicated to you, so we would like to understand what is your profile and which kind of experience you have in the mass casualty incidents. We kindly ask you to simply answer to the polls which will pop up on the right side on the screen. So the first poll has launched. The first question is, as I said, in regard to your profile. How would you describe your profile? We just leave still a couple of seconds to everyone to answer. Thank you. So I will stop the poll. I see that we have several profiles as part of this workshop, mostly experts involved in the EU funded projects as well as researchers, industry experts, patient ombudsman. So basically all the profiles are part of the session, which is very good. So the next poll again is to understand your familiarity with mass casualty incident. So we'll give a couple of seconds to answer the next poll. I see that most of you are answering already. So I'll stop the poll. Again, very good balanced. Some people do have experience, empirical experience with mass casualty, while some others don't. I will launch the next poll again in the field of trying to understand your the experts, whether you have familiarity with pre-commercial procurement procedures. I see that someone's still answering. Okay. It's very good to know that most of you know the PCP procedures. It's a very good hint for us. As mentioned before, the project is a pre-commercial procurement project. So it's very, very good. Okay, going a little bit more into practical terms, the project identified several stakeholders which are addressed when building the solution, which are the ones listed in the slide as well. So the solution is addressed mostly to emergency medical services, of course. So people working on the field and dealing with mass casualty incidents. But also other several stakeholders, such as organization performing in triage and mass casualty incidents, of course, affected citizens, so casualties as being part of mass casualty incidents, external emergency communication centers, such as, of course, hospitals will be part of our structure, project structure. First responders involved in mass casualty incidents, as well as third party, and lastly, emergency medical service training providers. So we address a pretty broad range of stakeholders. What we would like to understand from you is, which is also the next question, is whether you think that further stakeholders should be taken into consideration, or if we have covered, let's say, the most important part of the most important stakeholders already. It's an open question. You can also answer by using simple keywords, so no need to write too much. I will give you 30 seconds, 1 minute to answer the question. Of course, you can also feel free to jump in, and as it is an interactive session, we want you to feel free to jump in into the discussion whenever you want. So we have received some inputs already. I will still leave a couple of seconds. So I will start already giving some hints. I think, yeah, mostly we have already all the inputs as part of our stakeholders. Interesting is, as going back also to the presentation of Difuria, integration with psychological counselor services. So trying to involve also for the post-mass casualty some support for the casualties as well. So thank you very much. We go further to the next poll, which is the role of casualties again. So I will lock the voting. So, okay, what we would like to better understand is how to involve casualties into our system. As I was mentioning before, we have part of our stakeholders are, of course, casualties, because at the very end of the day, our solution will improve the quality of the services, so impacting also on the casualties themselves. And we, the project partners, have been given a lot of focus also on maintaining privacy rights. Because the solution will also develop a medical device in order to collect, gather, and monitor vital signs, which is a very important part of the triage management. So what we would like to understand, and again, feel free to answer the question or simply jumping into the discussion, adding consideration, just unmuting yourself. So what are the key aspects from the casualty or patient perspective which should be taken into consideration when dealing with mass casualty incidents? And I think some inputs have been already given during the speaker presentations. So you can feel free to answer the question with some keywords or again jump into discussion. I will start maybe also asking you to better clarify. I see the continuous monitoring of patients after first triage, which I would like to point out is one of the most important, one of the, let's say, central focus of the iProcureSecurity PCP solution. So it will be developed a system which allows the continuous monitoring of patient during and after the triage, during the treatment as well. So I see one answer: inequalities. The mass casualty incidents impacted in different way. I don't know whether the person would like to better explain in which way the mass casualty incident can impact, and whether the system can support in addressing these impacts on the casualty themselves.
Can I explain?
Sure.
Yes, I think that during our experience in earthquakes, but also during COVID pandemic, the impact were found particularly in women, in children, and in the older people, because older people, they have also the problem of literacy. They do not understand better the way to communicate with us when there are problems of events so great for them. So it's important to have attention, a specific attention to the older people, for example, but also for the population of the rural communities and disabilities, for example, also is a problem of inequalities in our kind of response. Thank you.
Thank you very much. So I see also, again, I go through all the several answers we have received. Promotes family unification, which is possibly also part of these of the post management of a mass casualty incident, and as part of the going back also to a potential support to be given to the casualties, which is extremely important actually. I see the fast transportation and treatment input, which is again already actually part of our solution to support a smoother and easier and quicker transportation and treatment of casualties from the area of the mass casualty incidents to the hospitals. I see another very interesting input is the access to incident documentation for insurance or further medical treatment purposes after the incident, which, if possible, if it would possible to better further develop it, because I think it's a very, very insightful input for the solution itself as well. And as part also of the interoperability and sharing of information, because I think the other scope of the project, of course, is creating a system to support operators. On the other side, also to creating good practices and best and good practices to be shared among the several stakeholders in several operators, emergency medical services. So the access to documentations and medical treatment after incidents is very important. Also, another comment is assure adequate response to damage, quality of care, privacy rights are important to access the electronic health record if possible. And to that, I would like to add again back to the point of interoperability. For the solution is extremely important to integrate data or system where possible, which are already in use by the procurers. See an indicator showing the status of family members of patients. I don't know if it can be further explained. If not, we go forward. Also, don't be shy. I mean, if you want to explain something better, just jump in and you can further explain the inputs you gave, which are extreme. I would then jump into the next question. There are a lot of comments and there are a lot of answers. So first of all, really thank you, because what you have written down will be taken into consideration and will be analyzed afterwards. So next question, next topic deals with the communication. And it was also mentioned during the presentation, I think the last one done by Maria Di Furia. So the importance of telecommunication and communication, especially during mass casualty incidents, of course. The solution developed by the project foresees also the creation of several communication channels to be used among the emergency medical services on the field, such as push-to-talk solution, telemedicine support, and so on. So what we'd like to understand is if there is any telemedicine tool available already or used or upcoming in mass casualty scenarios that you are aware of and that could be shared with us, because that would be an extremely helpful input to understand what is already there. Also through experience gathered from European projects as well in the same field. I will leave still a little bit of time, because so far the inputs are that there are not actually real solutions already used. An interesting input is that someone is aware of ongoing projects focusing on this. We would be really glad if you could maybe elaborate this a little bit more.
Hello, this is Martin Kostolny, ISAMI. I was written this message, and for example, we are working on a project Valkyries. It's just started within the Horizon 2020, and it's focused on communication between the responders on the mass casualty incident, covering 2 or more countries, and is focusing on medical services. So the technical partners are trying to develop a technical solution for information exchange and so on. It just started, so but this is one of the project I have on my mind.
Thank you very much. Very helpful. Maybe we can also get in contact to bilaterally to see the progress done by the projects. I see also that telemedicines have been used for diabetic patients. Because we have specific tools, but also psychological calling with citizens, image transmission, wearables device for EMS vital signs. It's another input which, in my opinion, would require a little bit more of elaboration. We don't have much time to go into each input we are receiving, but we would be happy maybe to get in contact and to better understand. I see in Trieste there is a pilot of innovative funding instruments to support integrated care in emergency services to avoid access to emergency room and avoid hospitalization of vulnerable groups, but without ICT tools. So thank you very much. Again, we have received many inputs, which will be further, and many more are coming. So we'll leave you some other minutes or seconds to finishing up. Also, if someone has a question, I've seen before someone raised your hand, feel free to simply unmute yourself and ask the question. Thank you. Again, that's also currently, the telemedicine is also currently used for military solution. So to see which other branches are this kind of technical solution used and where they can be taken over also, being useful for mass casualty incident management. Thank you again. I will go forward to the next question. It's about maintenance and security. Again, the project will create a medical device gathering vital parameters, several vital parameters, actually the ones you see listed in the slide. So what we would like to understand is whether there could be good practices coming from other projects, but also other research or practical experience, field experience, in which maintenance and security, the good practices came out for maintenance and security of this kind of technologies, which again gave their specific vital parameters. PCP. So if someone of you would like to highlight or give inputs on elaborating a little bit more, that would be highly appreciated.
Hello, this is Federico Carvajal. I just would like to point it out that there is an ongoing project that it is called Nightingale, that it is really in line with the iProcureSecurity PCP. So I encourage you to check this project, which is focused on early triage and also new digital solutions for monitoring the patients, and I think that it would be an important synergy for your project. That's all.
Sorry to intervene. Federico, many thanks. This is Eleftherios Zeunovou from ICCS. We are collaborating with Federico, and ICCS coordinates the H2020 Nightingale. I was ready, let's say, to share this information in the chat. Definitely our project shares a lot in the challenges, in the objectives, in the foreseen architecture, etc. And we are more than positive to collaborate and establish synergies. We are in the first months of the project, so probably the questions said also from your side are also our questions. And we'll be really happy to share information and collaboratively try to contribute in this important field.
Great, thank you very much. Thanks a lot. And again, it's this discussion is also will be further developed by bilateral calls to get some more details, because in just so a short time frame is hard to gather all the inputs we need. So it will require some further bilateral talk. We are coming to the end. I will go to the last question group on training and evaluation, because it is the one of the part of the solutions developed by the project. So what we would like to understand is whether there are any challenges or strengths which related to the training solution which should be taken into consideration when developing evaluation and training and simulations modules into the solution itself. And again, if so, maybe to get some further inputs and elaborate the answers so that we can get back to you and try to align or see how to we can better develop the solution itself. So far, it's really 50-50. So 50 view, it's for the no, and the rest for the yes. Okay, developing into the, again, 50-50. So if someone of you has good practices or hints which should be considered when creating evaluation and training solutions for mass casualty incidents, also thinking about existing training solutions from the procurers as well. I see there is one hand raised.
Yes.
Please.
It's first of all, if it's a challenge, and second of all, it's a question from our side, because we would like to know if training as a requirement means training towards the procured solutions or trainings of major incidents in general.
So what we would like to create is that the iProcureSecurity PCP solution will gather specific data and will support, as we were saying before, in the decision-making support, all the inputs given by the emergency medical services on the field will be fed into the iProcureSecurity solution, and they will be analyzed in order to create a report, an evaluation report. The evaluation report will include, again, all the data, all the inputs, all the procedures, and all the decision-making process which happened during the mass casualty incident. And these inputs, as part of the report, will be then used for the training module. So what we would like to extract then from the solution is also what could be good and best practices to be implemented by the procurers who took part to the mass casualty incident, but also to external procurers. So what can be shared and used as training module or training basis for the procurers, basically. And there, several solutions can be applied, such as the creation of, for example, virtual/augmented/mixed reality, for example, or any other solutions, integrating what is already there and what comes out from our evaluation. I don't know if it's clear or answered your question.
Yes, you did. Thank you.
And I see as outcome from the polls, we have a 58% of yes, meaning that there are already challenges and strengths related to training solution which should be taken into consideration. If you want to jump in and explain better what they are, I know we are already late, but otherwise we will circulate an email with the inputs gathered from you, and get in touch with you to better and further understand the inputs you have given us, and they will be part again of our. It's extremely important because they will be part of our call for tender, which will be published in May. So they will be taken into serious consideration. I would like to close up here very late, 15 minutes late, our workshop, and thank you again for your support, which has been really, really highly appreciated. More information on the EU-funded project and PCPs can be found on the links below, and as well as on the European Commission Innovation Procurement newsletter, which I invite you to check. And otherwise, I would like to thank you all. Please feel free to get in touch with us for anything. We will do it anyway for the good outcome of the project. If you have any questions, please, we are still here for the next 2 minutes. Okay, then. Thank you, everyone. It was a pleasure, and we will follow up with further information and inputs. Thank you.
Thank you very much. Bye-bye.
Thank
Thank
you.
you.
Bye.
Bye-bye.
Thank you very much.
Thank you. Goodbye.
Bye-bye. Thank you.
Bye.
Thank you.
See
Bye.
you.